All right, Jeanne, thank you for joining us today. You've probably heard the phrase "think outside the box." In healthcare, sometimes the real opportunity, isn't thinking outside of the box; it's really changing it entirely. And we're here speaking with leaders like yourself about what they would like to change in healthcare specifically, and especially where technology could help to reshape the system. Jeanne, you've spent decades on the front lines of emergency care. You're sitting at the intersection of healthcare, technology, and one of the industry's more urgent issues, keeping clinicians safe in an environment that's increasingly not. So, for the people who may not know your work or about you yet, could you give us a quick version of what you're passionate about affecting or changing in healthcare?
Yeah, sure. Thank you, Tony. It's a pleasure to be here. My short background is a lifelong emergency department nurse, certified in both the care of sick and injured children and adults. And I spent a majority of my career at a tertiary pediatric uh, children's hospital, and then did some consulting. And now, for the last 7 years, have been specifically working as a clinical strategic advisor for a wearable duress. That is a canopy wearable duress button. So basically, what a wearable duress button is, for those of you who don't know, and I feel like I represent the 4.7 million nurses that are practicing in our country right now. A wearable duress is like having kind of a mobile panic button that would be attached to, say, your ID badge. Um, Whether or not your listening audience is aware of this, nurses are 4 to 5 times more likely to be injured at work than a police officer or a sheriff. So when you think about those staggering statistics that come to us mostly from Press Ganey, they also tell us that 2 nurses an hour are injured at work. So by the time we're done talking today, 2 people's lives may be altered dramatically, and changed for the worse, actually. And so I like to bring awareness to what we're doing in terms of wearable devices, but in general, talking about workplace violence in healthcare and how we can think outside the box, right? To creatively to keep staff safe.
Yep, that's awesome. And thank you for being passionate about that. I think it's a very important piece of the challenges that you've described here quite well. And I think a lot of people may not be aware of that, especially that statistic. It's pretty crazy to think 2 people. That's significant. Could be having life altering changes to their life, um,
Correct.
trying to serve people. So very good thing
Yeah.
to try to correct in any way possible. You've described this a little bit, I think, but maybe we could talk a little bit more about what the challenges that you're seeing, specific challenges that you're seeing. Obviously, it's safety. Is how do you solve that, or what is the way of solving that? This wearable is one method. Is there a support system around that? How does technology support that generally?
Yeah. It has to be a comprehensive workplace violence solution. A
Yeah.
wearable is just kind of one spoke in the wheel. In 2024 into 2025, the Joint Commission came out with regulations requiring all hospitals to have a comprehensive, kind of multidisciplinary workplace violence committee that looks at opportunities from kind of a 360. Wearables, weapon detection, they're one and two spokes, but having policies, having leadership, having no tolerance, having a culture, having everyone's voice represented in those solutions are what is key. We like again, we see ourselves as just one spoke in that wheel, and it really has to be a priority of the organization to keep staff safe.
Yeah.
In 2026, we know there are competing priorities for budget, and how do we sell, how do we influence, how do we create that level of urgency with our stakeholders, and really the clients that we work with, the some 60, 70 large logos that we work with now have made it a priority. And in turn, they're seeing benefits. When staff feel safer, they deliver better patient care. And
Yeah.
when better patient care is delivered, the outcomes all in total, what that organization is trying to create. So, um, showcasing a return on investment in terms of those competing priorities. Everybody wants to sell something. Every hospital needs something. Their
Yeah.
their budget, their biggest line item is salary, and how do they keep salary? One of the ways we think we reduce turnover is by helping staff feel safe and less burned out at work, with the constant barrage of workplace violence.
Well, that's great. And, I'm not in healthcare directly, but, I can say that just feeling safe or feeling, like you're able to move the needle as an employee at work is a great way of making sure that they're delivering the best way possible. And so, that's a huge deal. What else did I have
Deal.
here?
And
Yeah.
there, I mean, if you go back all the way to, the 50s, 1950, Maslow's hierarchy, right, which is a framework that people still use today, and I use it too.
Yeah.
If food, air, and water is basic, second level is safety. And in order
Yeah.
to deliver that excellent patient care, like I outlined, or even to feel like a contributing employee, you have to have, food, air, water, safety, and safety is paramount,
Yeah.
when it comes to delivering excellent healthcare.
Yep. Baseline. Yep. Makes sense. If you could snap your fingers
Uh,
and change the box in healthcare, what would you change?
Well, this is going to sound rash, and I mean, there's a million things I would change, having been in healthcare for almost 4 decades.
Yeah.
Um, I would modernize it in a way that other institutions have been modernized, like, for example, banking. Um, you know, it, Hospitals are still stuck with archaic infrastructures and um, systems that don't speak to each other, and all those things that you can't imagine. But it's really not that easy to rip and replace. But
Yeah.
if I could snap my fingers and think about, in my career, another piece of technology that changed the way we deliver patient care is called the pulse ox. And you may have seen it before. It's that little band-aid they put on your finger that looks like ET, and it measures your oxygen saturation
Yes.
when you're having breathing problems. And
Yes.
through the industry, right, that pulse ox became what's called the fifth vital sign, right? So you have heart rate, respiratory rate, blood pressure, and pulse. And then it was pulse ox is the fifth. And so that industry kind of pushed that device on us as healthcare workers. And now it's gold standard, platinum standard, whatever standard you want to use. You would never consider putting a patient after triage in the lobby with a respiratory complaint without checking that pulse ox. I'd
Yeah.
like to be as brash enough to say is that every healthcare frontline worker should have a wearable device. If it's not mine, fine. Have some. We see staff that still have stationary panic buttons that are under the desk when you're trapped between the patient and the desk. You can't get it.
Yeah.
Keyboards that are, again, you can't get to the keyboard to hit F7. Push button, wall mounted, that causes a further escalation in potential harm to that worker who's in that room.
Yeah.
So if I could be brash enough to say is get something. If it's not us, get something, and don't insult your staff by getting rape whistles or pull tags that make a large noise or further escalate the situation. There's plenty of technology out there now to keep your staff safe so that they can do what they've come to work to do, and that's deliver excellent patient care.
I think that's great. There's other use cases, right, for wearables or other things that are, that have been discussed, I think, fairly recently with the advancements of technology, which is, aftercare, right? So I think there's a big space for that wearable. From a safety perspective, it's a no-brainer. But also, you could send a patient home with a wearable device to make sure they're not deviating from some form of a standard, right?
Oh,
10% up
sure.
or down is a good indicator that you might need to come back and see us.
Yeah, no,
So
of course.
wearables in general, I think, are a
Yeah,
really
and
cool
I've
space.
adopted them. I don't know if you've adopted them. I've adopted wearables in my own house, in
Yeah.
terms of fitness and trying to stay healthy. But a previous company that I worked for, we put some gateways or beacons in homes to measure vital signs that,
Yeah.
electronically to keep heart failure patients at home, and really start to see a turn before it requires hospitalization. And that's the parallel I'd like to draw with the wearable, right? When you have something on your body, your we use this term, the spidey senses, which you know what I mean. The
Yes.
hair on the back of your neck goes up. You're not comfortable. You're feeling, like you're in a bad position in the room. Something's starting to escalate. Having that wearable where you can press it on your body and not waiting for a full out crisis, but you're
Yeah.
pre-crisis. What you're doing is turning a panic button into a earlier de-escalation tool. Because if I
Yep.
press my button as it's starting to simmer and spike, you come in and you knock on the door and you say, "Hey, Jeannie, everything okay in here? The charge nurse is looking for you, or can you step out for a second?" Sometimes it's those extra pair of feet or set of eyes that enter the room with you that breaks the tension in that room.
Yeah.
And the patient or visitor, takes a deep breath and some calm, reassuring words of encouragement to help understand what the rise is, and what they're upset about. But you get the event before it really is crisis. So it's that
And
simmer and spike, and then you prevent the crisis, and then you're not coming in to rescue me. You're actually coming in to see what you can do to help me in that situation.
you said it. I was just going to say, I mean, it's preventative care. It's truly preventative
Mm-hmm.
care at that point instead of a reactionary response, which is exactly what we want, I think, in all of these cases.
For
So
sure.
yeah, that's a really good method. Um, why do you think that we're here? Why do so many health, technologies or facilities fail at this safety piece? Is it the
Well,
environment? Is it a whole bunch of factors, or is there a silver bullet besides the wearable device
yeah.
that we're referring to already?
Yeah, I mean, I think there's a compounding silver bullet, but if you think about our 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 State of the Union, to
Yeah.
speak, is just the level of incivility that has kind of spilled out due to stressors, economic pressures. In a hospital, it's bad news sometimes conveyed. It's long waits. It's stress. Any there's no one more stressed than a parent of a sick and injured child.
Yeah.
So the open communication, the lack of waiting, the staying in touch is really what makes that difference. So that you're not letting their own thoughts creep into their head, and they're always bad thoughts.
Yeah.
That's normal, right? Um,
Yeah.
so open lines of communication, line of sight into what's happening, good sound plans for what to do when patients and visitors start to escalate. But just considering all the pressures that people are under in our world, they used to leave that. We used to say you leave your luggage at the door, when you come in to take care of patients. But now people are bringing their luggage in with them,
Yeah.
literally and
Yeah.
figuratively, and so those stressors just add to the stress of being in the hospital. My own father was in the hospital 90 times for heart failure, and he at least signed out AMA 4 times, much to my embarrassment. But what he was subject to was repetitive broken systems, and
Yeah.
he knew it could be better, and it never met those better standards. And so, for a lack of in frustration, and for a lack of better words, he chose to just leave early because he just felt like the right hand didn't know what the left hand was doing. And so he was a civil kind of a guy, but
Yeah.
in that situation with poor communication, poor coordination, he would lose his marbles. And
Yeah.
luckily he just took it out on himself and left. He didn't take it out on anybody else. But in 2026, sometimes people are striking out at other people, rather than just taking it out on themselves and choosing to leave.
Yeah, it's rough. Rough. A lot of things I think are at play there. To your point too. Yeah, there's no silver bullet. Where do you think technology could? I think we're talking about this quite a bit about wearables, right? Where do you think technology could most dramatically change the system? Is it the wearables? Is it a combination of the wearables and the human factors, or the economics and stuff like that too? Or
Yeah, I think biggest frustrations that starts right off the bat is kind of, it's a big bucket, but it's called care coordination.
Okay.
That communication, planning, the articulating the plan to the patient, not just to yourself. I've got a great
Yeah.
plan for you, Tony, but if I don't tell you what the plan is, then you're just in the dark, right?
Yep.
So I think care coordination from the minute, you kind of step into the organization and when you leave the organization from that episode, so that episodic visit continues, is really where we could get the biggest bang for our buck. I mean, if you've been to a healthcare organization that kind of has a robust app, portal, they're good at communicating, they let you know there's delays or interruptions and this and that and everything that can go wrong, you sometimes feel more informed. But
Yeah.
when, again, use my father for example, he had a flip phone, he didn't have a smartphone, so those kind of coordinations really needed to be verbal, right, and
Yeah.
not just seemingly broken. So care coordination is the biggest thing. I mean, I think that would be one of the snap your finger things. But we know in nursing it takes it on average about 2 hours to discharge a patient from the hospital at home. And when you're to go home, when you're the patient in the ER waiting for that bed, for that patient to be discharged, it takes 2 hours. That's a long 2 hours on a stretcher that you're frustrated, hungry, cold, tired. So all of that care coordination trickles downstream, and it becomes an emergency department problem sometimes with throughput. But it's overall care coordination that really, I think, if you had a silver bullet, if we could solve that problem, a lot of the other problems would be eliminated because of better coordination.
I love that. Just the idea of that in general sounds wonderful to me. Just based even off of my experience with the
Mm-hmm.
healthcare system, and I think
Mm-hmm.
my observation is that there is quite a bit of a gap, or missing context in the journey.
Mm-hmm.
Right, like me visiting a specialist, I feel in many cases like that specialist isn't up to speed, and I'm the one giving them up to speed, and that's a trust loser for me.
Mm-hmm.
And it's like, well, how did I end up here without you being pass along this info? Or how, there's just a lot of little examples like that. And I'm talking about routine visits right now, but I've been in cases where I'm like, oh my goodness, if this person knew any portion of my journey to this step right here, they may have responded differently, or they may have had a different answer for, or a different thing to offer for my outcome today. And so like that individual, personalized, holistic care, I think would be an amazing thing to see. How we get there with
Yeah,
technology is an interesting question.
yeah, it is. And I mean, the observation you just made about, like, you're seeing a specialist, and pretty much you're in generally in good health. I am too. But imagine you're coming to see somebody who you would have assumed saw your biopsy report or your actual biopsy pathology, and you get there and they're unaware. Now you've
Right.
got that level of stress that you think you have cancer, you don't have cancer, you have some kind of cancer, and you get there and they're like, oh, it never got over here, and you waited however long for that appointment.
Yeah.
um, and then the other thing that we're seeing is that stress is spilling out of the hospital and like into medical arts buildings and into doctors'
Yeah.
offices and into ambulatory sites. The last two healthcare murders occurred in ambulatory sites, so it's not just in acute care, boxes. That level of frustration. But imagine how you would feel if you're, waiting for your life's results on this smear, and you get there and the physician's like, well, I never received it, or
Yeah.
whatever the
Yeah.
excuse is. You can imagine that level of frustration,
Yeah.
or we can't imagine that level actually. So that's why other people, really start to act up.
I can imagine. No, not great. What do you think is standing in between that concept and what we have here today? What is the change needed? Is it is I think we talked about this a little bit. It's probably a combination of technology, but it's really somebody who's able to to look at the holistic problem and to have maybe different technology solutions for different milestones. But what is your take on that? What's preventing that change right now?
I think it goes back to like money. I mean, the
Yeah,
hospitals have they don't have an infinite budget. They have a finite amount of money that they have to work with, and they have to prioritize what needs to be done, right? If they have to put a new bed tower up or they have to get a new MRI, I mean, those are things that have to happen.
yeah,
But what other slivers of money could be dedicated towards some of these things: care coordination, workplace violence, safety? An interesting concept that we've seen lately is some of our organizations that we partner with, and our clients of ours, they've gone to their foundation to look for kind of like I would call it a loan, but the foundation funds these kind of workplace violence initiatives, whatever they may be, whether it's technology coordination, um, or in some places like weapons detection, because the foundation is represents the community, right? And so the community, they have resources, they have some money, and they could do that, and then they can celebrate. Look, we respect our staff, we care about our staff. We're going to go ahead and buy this for them. That's been a really great thing that we've seen in the last, like, say, 18 months. The foundations have been stepping up to help fund this. But honestly, it's just with the changes in our government, the changes in reimbursement, there is just not infinite amount of money, because every single CEO doesn't want to lose sleep over staff getting injured at work, but they have so many other things that rise to the top in terms of priorities.
it's a little bit of the ROI, right? Like
It
having
is
the
the
ability
ROI.
to prove the ROI and to make it so that it squeezes in between the priority of something else. Yep, that's
Yeah, and
interesting.
if you really have a high workplace violence incident percentage, and your staff turnover is high, and you can measure it, and you could look at lost work days from being injured, or some are just silently absent because they just, if they had a
Yeah,
patient yesterday who hurt them, and then they have to come back today for that same assignment, like, you're dreading that you might not come to work. um, you you almost can't afford not to keep your staff safe. and I
yes,
and I have said that to some people. Like,
yeah,
what's the cost of a lawsuit? What's the cost of that settlement for the nurse in Florida who lost vision in both her eyes for the rest of her life? She's a young woman. She's in her 50s. What's the cost of that versus the cost of some type of um, technology, which is minuscule compared to that?
yeah.
So, lost days of work, lawsuits, injuries, workman's comp, some of those things tie back to ROI. And, we as a company, Canopy, have an ROI calculator that we can give to the client and say, listen, you don't have to show us your numbers if you want to be, don't want to share them. That's fine. Here's the calculator. Throw in your own
Yeah.
numbers. Here's what we suggest are national averages, and you can look under the covers yourself and see where you think this would help you. And generally, in terms of cost, it's probably less than a few of your traveler agency contracts that you have right now, supplementing your full time staff. So we believe that helps create a culture where staff will stay, and you wouldn't need agency in the future.
I imagine, and keep me honest, but I imagine that a lot of the challenges in the places that don't have a bunch of statistics or numbers for, those violent situations, and then they have one on a random Wednesday afternoon, and they're kind of reacting to it, right? So, like, smaller Met, right, is maybe doesn't have as much of the violent reactions. There's got to be some, but
Well,
like
you
that's
bring
got to
up
be the
you
challenge space.
you got it. You bring up a really good point, because every single hospital knows their numbers. They know their turnover rate. They know their workman's comp numbers. They know their absentee
Yeah,
numbers. They know their lawsuits they're paying out. But what happens is, you bring up a great point, is that not all staff report all incidences. And so part of the culture is that's just part of the job. You get
yeah,
yelled at. And so then when you describe something just comes out of nowhere on a Wednesday afternoon, it may have been percolating with that patient for the week, and
right.
just, as I described, simmering, right? And so if you're not taking the time, or having the leadership help the staff take the time to report all incidences, no matter how egregious or not, they need to be reported, because then the manager has a better perspective of what is really happening on their unit versus only what they see, which are the really big ones that rise to the top.
Yeah, right. The ones that need to act on now. Yeah, that makes sense.
Right.
Um, my last question: what innovations or technology or otherwise excite you the most right now?
I think what we're seeing in the safety space, which I can speak to the most, is the integration with some AI and cameras. So, for example,
Yeah,
if I'm in patient room 501 with the door closed for my patient's privacy, and I'm feeling uncomfortable, I'm feeling isolated, the door's closed, and if I were to press a wearable or activate some type of alerting system, um, the camera in that area in that space. Remember, all hospitals are pretty heavily cameraed. That camera would, in addition to the a wearable or the alerting system that alerts, the camera would activate in that space where I am. And so the security department can really see and triage what's necessary. Is it,
yeah,
am I already compromised? We need to send everybody full blaze. Is it, just starting to percolate? I'm in a good space. I'm close to the door. I'm safe, but I'm still not feeling comfortable. They can, get there and respond as quickly as possible. So the integration with that, and then there's some ambient listening. So if you hear some aggressive voices or you see some aggressive actions that cameras are turning on, activations are happening, those are all going to be, the wave on top of kind of what we do, but really
yeah,
adding to the crispness of the room level accuracy where we are, the cameras on it, the listening, getting, so even though I might not be feeling in duress in that room, if the camera's hearing something or the listening is hearing something, they may activate on my behalf, and
right.
say, hey, we feel like this is getting a little bit out of your control. Even though you're an experienced nurse, we wanted to send some extra manpower in there. So I
Yeah,
think those are the things. And I think, when we go to exhibit halls, we just were at a couple big nursing conferences, like to a man, every single person comes to our exhibit area and says, oh gosh, we need that. Like until that sentence doesn't happen, like we have to continue this mission
yeah,
to protect lives while they're at work, because really outside of healthcare, the typical, like in the suburban neighborhood I live in, people don't realize I'm at such risk at work as our local police officer. And so we have to really keep shining a spotlight on how just unsafe healthcare is right now for their employees, and what we can do to keep it safer.
well, I'll tell you, I overall great talking to you, and I wanted to point out, I learned that statistic and how significant, that sounds to me is yeah, I don't even know where I'm going with that one. Very significant that hearing that number. I had no idea. Like I knew that there
Yeah, no,
was
it's like
the
it's
potential,
there.
but
Yeah, it's 48 a day. So if you take 48 times 365, I was trying to do it in my head while we were talking. I couldn't do it. So that's how many people are injured. But like I like to say it in a day. Um, I'm going to say that on Monday at Becker's. I'm the only nurse on the panel at Becker's, this workplace violence initiative, and kind of talk about, like, by the time this panel is over, again, two lives may have been dramatically altered.
yeah, it's amazing. Yeah. And, I think there's a lot of, your answer there for the innovations that excite you was really interesting to hear. And I'm seeing, I think, a lot of those things too. And when you were talking about the really cool tech with the watch and the badges, even, just thinking of how AI could enhance that, right? There's plenty of machine learning that's capable of understanding intent with body language and with tone and stuff like
Sure.
that. So, just hearing that come to life is a really cool thing. And I'm a big proponent of finding ways of making technology get out of your way. And I think for the past at least 20 years of my life, I've been learning how to wield technology and how we can make it do all these fun things. But, after quite a bit of time, I've recognized that like it gets in my way a lot, and that's because we can look at it and all of the things that it does now, which it didn't do before.
Right.
However, I think the next logical step is how do we make this thing continue to do what it's doing, maybe a little bit better without us, interfacing with it constantly or fighting with it. And so that's a really good example of that. Let's raise that flag, or let's get some of those sensors to act or to do something to help prevent this, or to at least, document the situation properly, hopefully de-escalate, but without an action from a human being, because
Yeah.
that's magical. So I
Most
love that.
most technology implementations that nurses, I'll just use nurses for example. I'm sure it's probably physicians too. Nurses have been exposed to, out of the box, a nurse will create a workaround because they're so horrible.
Yeah.
They're multi-step. So if the task that they used to do took 4 steps, now that there's technology involved, it takes 10. They're going to get
Mm-hmm.
it to where they can misuse that intent and get back to 4. And
Yeah.
so that part of the problem with Canopy and our device is that it is kind of simple. And I feel like, doubting Thomas, like, from the Bible, stick your finger in here. It really doesn't. It is as easy as it says it is. And a lot of
Yeah.
people will try us at a pilot or try us at their suburban campus because it can't be this easy. And
Yeah.
in many ways it is. And so that, because we're beaten down by such bad product and implementation that, we suffer from that. And on the end, because people are so used to terrible implementations and projects.
Yeah, it's true. One of my favorite quotes is that simplicity is the ultimate sophistication. It's very hard to get there. And my background is design and user experience, so web development and app development for the most part. And many of the times that I was brought in to help, it was because of exactly what you're describing. Hey, we've got this really cool outcome, this really cool thing that helps the business and it helps our end users, but nobody wants to use it.
Right.
Because it's
And they
added
don't
10
use
steps
it.
to their process. And they
Exactly.
don't.
They won't use it. Like so some other competitors of ours, like you have to charge it and you have to hand it off shift to shift and you have to remember it and this and that. And when we get there to do rounding, they're all on the desk. Oh, that battery's dead. But what
Yeah.
happens is, I wear it for 12 hours and give it to you for the next 12 hours. Whoever gets it after that, it's dead. It never got recharged. It never got rebooted, whatever. And so the simplicity of ours is it's just yours. It's got a 7-year battery. You put it on your kit, you're good to go. It's like a
Wow.
small, like a pat of butter so that it doesn't weigh down your badge, because nurses wear hand washing badges. They wear this locating badges, and you're asking somebody to wear something else. So it has to be comfortable or they're not going to
Yeah.
wear it because they've already discarded other types of those things. So we have to really be conscientious of that.
Boy, if we can get more of my wearables to have a 7-year battery life, I'd be a
Mm-hmm.
happy camper.
Yeah, no kidding. Well,
I
remember
just,
that doesn't it just sends a beacon. It doesn't need
yeah,
to so my Whoop or my whatever I'm wearing has more activity, and
yeah, of
so it
course.
has to be charged. But these, hopefully they're not being used like my Whoop is for
Yeah,
workplace violence. So
yeah,
anyway,
amazing.